So I saw this patient for incisionless otoplasty. What that is for patients with prominent ears, and this patient, as you can see, has a high bowl, what we call a high conchoidal wall, so this part was out. He's got a weak antihelical fold, so this fold here, so this part is out, and he's got a little bit larger ears. So those three things then led me to want to do an incisionless otoplasty on him. He wanted his ears back in a nice, normal, natural position. So how do we do that with the incisionless technique? First, what we do is after having our good discussions, I talked to him about his goals, and we went to the procedure room. So in my office with the patient totally awake. Yes, he had a little bit of a sleeping pill, but otherwise totally awake. We actually scratched the front part of the ear and scratched that bowl such that the wall that's high was able to bend over and become part of the outer part of the ear. And so now the part that was high now became lower. The part that was weak in terms of a fold became better. And so we brought the ears back into a really nice position with him totally awake. He was talking to us the whole time. We put in some stitches that go from the back to the front, totally underneath the skin. And so we pinch down those stitches all together and tie them at once. We literally get to sit him up and have him look at each ear individually. It's an amazing procedure where we get to do one ear and then the other. So I just saw him for his post-op. He's now back at 3 months. So I see everybody back at 1 day, 1 week, 3 months, 6 months. So this is his 3-month visit. He's ecstatic. He really loves his ears. He loves the beautiful natural, the folds are there, the contour is better. He can now not have to worry. His hair is a little bit different, which I always love. He's really happy. So I love the incisionless otoplasty. It's a beautiful permanent technique that I do in the office with patients totally awake. You know, they have a little bit of numbing on board and one little pill and they're off to the races. And actually this week I did it without a pill for that patient. So everyone's a little bit different. We're able to achieve beautiful natural otoplasty results without a big scar in the back of the ear, and they're walking out of the office pretty easily. Thanks so much.